All right, our next subject is sensitive. It's a sensitive subject, but 50 million men suffer from ED. You know what ED is?
I know what it stands for.
Erectile dysfunction, right? Many are using drugs like Viagra to help, but many are not aware of how certain foods can interact with these types of drugs. I didn't realize that.
Joining us now to explain is the Chief of Robotics and Minimally Invasive Surgery, our favorite kind of surgery at Mount Sinai Medical Center, Dr. David Samadi. Welcome, sir.
Good morning.
So tell us about this new study, because you say ED can actually signal some other kind of problem, health problem.
You know, today in 2011, the way we look at ED is very different than years ago. Now, if I see someone in their early 40s and 50s that come in with erectile dysfunction, we don't just give them a medication and send them out of our office, because the same arteries that can lead to ED work also, such as causing the heart attacks in the heart. So if someone comes in with early onset of ED, that could be the first sign of heart attack. And that's why we really want to study them, check their cholesterol, find out exactly what kind of atherosclerosis or blockage in the arteries they have, and treat them as a whole, as a patient, not just that specific disease.
Interesting.
And that's a new way of thinking about it.
This dysfunction could just be a sign of something much larger and much more important, cardiac difficulties.
That's exactly right. Now, once we rule all of that out, Greg, then we can start thinking about some of these medications. And fortunately, there are a lot of options out there. You know, Viagra, Levitra, and Cialis.
Yes.
What's the difference between them?
Well, Viagra and Levitra, the blue and purple, they're short-acting, so they stay in the system for about 4 hours. Cialis is a longer-acting. It's the weekend pill, and now they have a daily Cialis that works for the entire day. What's important is that, like, for example, if you have fatty food and a big dinner...
Like a steak or something like that?
Exactly right.
How about lasagna?
That too. Viagra may or may not work really well, because that fatty food can absorb some of the effect of that. So that's very important people to know. And Levitra may work if you have some food on board. In reality, you really want to have it with empty stomach. That works really well. With Cialis, obviously, because it stays in your system for much longer, you don't have to worry about that.
Well, maybe you don't want to eat after having that pill either.
Well, we have to find out from Greg if he can answer that question.
I don't think so.
I just want to make sure which one we're talking about. What one is the one with the bathtubs? They're sitting on the hilltop with the bathtubs.
Oh, that is so funny. I love those commercials. They bring bathtubs.
The bathtubs to the top of some mountain, some hill, and they're
at apartment buildings.
Individual bathtubs. They go through all that trouble to bring a bathtub to a mountaintop.
They need to soak, I think.
Wouldn't they just sit in the same bathtub? You ever notice this, Doctor?
Yeah, that's true. Well, that's a Cialis one probably. And look, it's a big business, and they're spending billions of dollars in this. But what's really important is that, like, you cannot just take these medications on your own, and you can't let these ads affect you, because if you have if you're taking a lot of cardiac medications, or if you have had history of high blood pressure, heart disease, you really want to be careful and talk to your doctors before you take.
I want to get your take on this. A lot of folks go to Mexico for their medications, or other countries via the internet, to get it for cheaper. How concerned are you as a physician? Because I've heard from people that this stuff is the same thing. It's just brand X. It still works.
Well, you know, I know a lot of people go to Canada and India and they order this online, and it's much cheaper. Greg, that always concerns me really much, because you don't know exactly what you're getting. It's not FDA approved. I'm not sure if they're just getting some sugar pill that can have a placebo effect and work for them, or it could be a real medication. So I don't recommend it. I really think you should talk to your doctor and make sure that they look at all of your medications before you take these pills on your own.
Hey, Doc, I'm hearing a lot of single people use these pills not because they need them, but because they think it can enhance whatever, their performance. Do you see an uptick of young people who don't need the medication actually taking it?
We saw that at the beginning when it started about 10 years ago. A lot of young guys were coming in and asking for this. And the truth is that in younger guys, this medication really doesn't make that much of a difference, except, psychologically it may make you more macho. But there's no truth to that. And you really have to, again, be careful, because it can have some side effects. Most of the side effects, fortunately, are not that bad. Hot flushings, headaches, runny nose. So it's.
Can't you lose your hair too?
No, never heard of that.
No, just headaches, flushings, and extra machismo. Haven't heard. Nobody says macho anymore. You ever notice that? It's just like it faded in 1982.
Those are mostly short term, and they should resolve on their own. And so this is a very common disease, and we have all the treatment, but under supervision, it works really well.
Dr. David Samadi from Mount Sinai, thank you so much for being here.
Thank you so much.